Enrollment begins this Saturday for the Affordable Care Act, and the government says the website has been updated and fixed.
This comes on a day when CBS News aired a clip of an Obamacare advisor joking about the program. Local 12's Paula Toti tells us what we all need to know about year two and how the administration is defending the Health Care Act.
The Obama administration predicts 83% of families that enrolled in one of the plans in the health care exchange last year will return this coming year. And overall, enrollment will grow 23%, still under 10 million enrolled. But the White House also says under the Affordable Care Act, or ACA, the country now has just over 10 million fewer uninsured individuals. This year, there are 25% more plans being offered at healthcare.gov. The new Health and Human Services Secretary, Sylvia Burwell, came to Cincinnati today to emphasize the updated website was tested this time for 10 weeks and not 5 days. And the screens you'll need for sign-up have been reduced from 76 to 16.
The operational functioning of the website, it's something that we learned a lot of lessons on last year and have implemented those. Some of the most important lessons, though, have focused on testing. Instead of 10 days of testing, 5 weeks of testing. And while there will be issues, every website has times when it's down and things happen. What we believe is that this experience over the 3-month period, that the consumer is going to have an improved quality experience both in terms of that functionality and their ability to engage with the website as a consumer.
Burwell says she has been very careful about transparency, explaining her estimates for growth in enrollment, and says taxpayers have saved money in Medicare costs and individuals enrolled have saved on insurance costs. Despite one of the architects of ACA caught on YouTube saying it has not been affordable and Americans were kept in the dark about things like healthy people subsidizing the unhealthy.
Lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever.
What is certain is anyone without health insurance and not eligible for Medicare should ask themselves if they need to go to the exchange for a health plan. Those people without a hardship exemption will start to see tax penalties when they go to do their taxes for 2014. The Supreme Court is taking up a challenge to a major provision of the ACA, but it is the law, and health insurance for most of us is mandatory.
The program now has 1,000 new customer service representatives staffing the helpline for the website. You can get help by phone or online. If you've already signed up for one of the plans and are re-enrolling this year, 90% of your information is already loaded into the system, so again, it should be easier. I can't say I've tested the site, but one of our reporters said that he did. He said he and his family still found it difficult. As for prices, I just had a viewer on Facebook tell me her premium has jumped $100 this year. So reach out on Facebook. Let me know what you're finding. You can start shopping for plans now, today, but the sign up begins Saturday.